Okay. But as I've said a few minutes ago, pain is not just about signals coming up from the body, from the part that experiences pain, all the way up to the brain. There is an important part in pain perception which has to do with signals that the brain sends downwards to the spinal cord. What happens is that there are definitely these pathways that go down the spinal cord, and they seem to affect sensitivity to pain. And I would like to connect this with other talks that we've other sessions that we've had before, in saying that what the brain why the brain would regulate this pain sensation is that the brain provides a context, provides an interpretation to the situation that may make the pain more or less important to perceive. And you may remember that, for example, there were times that, say in an emergency, where the brain may actually cut off this experience of pain, and there's other times that we haven't talked about very much, where the brain wants to pay particular attention to the pain, whether this is warranted or in chronic conditions whether it's not. So when it comes to medication, antidepressants like amitriptyline are very useful to treat pain by acting on the nervous system. They treat sleep problems, irritable bladder, and they do so whether the person is depressed or not. Another medicine which is specific, which is used a fair bit in pain conditions that often go with functional neurological symptoms, is gabapentin. And this was originally used in epilepsy, but its use in functional neurological symptoms has actually very little to do with epilepsy, and a lot more to do with pain often. Now, unfortunately, many people are on tablets and they don't seem to benefit from them. You hear it said, I'm on tablets, but they're doing nothing for me. Now, this may be because you're not on the right dose. You may be on too small a dose. And, well, that's easy then. You go to your doctor and they may increase the dose. However, it may be because it's actually not a medicine which is effective for your symptoms. And this is more of a difficult decision to decide that you've tried this, it doesn't work, and you're not one of the people that benefit from this medication. And it's particularly hard to judge sometimes with antidepressants because they take a long time to act. It is thought that they take even longer to act in the case of functional neurological symptoms than they worked in depression. So those of you who have actually tried antidepressants for depression, you may have heard that try it for a month. We have to give it a good month. And here it's almost 3 times as long that we have to try it for. But not all is well with medication. When you take medication, a lot of the time you may experience stigma. You may experience, well, I'm not quite right, I have to take this stuff. And it makes many people want to stop it. Many people are rightly concerned about side effects. But more than that, they feel that they may have heard that the medicine causes harm, including addiction. Most of the medicines that we've talked about here don't cause addiction, but the sleeping tablets that we talked about here do. Side effects. All medicines have side effects, and those are important. Another thing that you hear said is that, well, why take this? Because I'm not depressed, I'm not anxious, I'm not epileptic, I'm not mentally ill. We spent some time already talking about that, but it is something that you may have felt. So all these things may need to be discussed with your doctor before they prescribe a particular medicine for you that is known as, say, an anti-epileptic or an antidepressant. Side effects. I'm going to use the example of these tricyclic antidepressants like amitriptyline here. These are particularly helpful in patients with insomnia and pain, but can cause drowsiness, dry mouth, and these can be unacceptable. People can feel pretty bad about them. The medicines affecting the serotonin pathways, the so-called SSRIs and related drugs, are about as effective in general as the tricyclic antidepressants, and they are probably preferable in people who have got other conditions, who are elderly, say who have got heart disease, but they also have side effects. And they seem particularly to cause nausea and stomach upsets. They're also they don't seem to be quite as good at treating pain compared to the tricyclic antidepressants. Just to conclude with antidepressants, neither of those categories seems to help the symptom of depersonalization, which I mentioned about before and often happens in functional neurological symptoms. So, in summary, people can get better without the tablets, but for particular symptoms, they are often worth trying out. Okay, so we come to the last part of the talk, which is the suggestions for homework. Well, there wasn't much in terms of skills in this talk, but there are some goals that you may consider sort of setting for yourself that may help you in your recovery from functional symptoms and which relate to medication. First of all, ask yourself, how well do you understand these medications that you're taking? Do you need to understand some of them a bit better? Second, think, are you really taking medications that may not helping you anymore? And if the medications are not helping you, or they are not helping you in the way that your doctor intended, do you need to discuss this with them again? How well do you communicate with your doctor about your medications? Sometimes it is difficult to have a conversation with your doctor about your medications. Time may be short, there may be other issues. So how well do you actually communicate? If you have questions, for example, about things you have read or about this lecture, or if you need more information, please ask. And here ends this talk. Thank you for your attention, and we will see you again in the next session.